guys, so let's begin treatment refusal. Right. So we have got, many scenarios where you will see the patient is refusing the treatment. Yeah. So how to manage those cases and how to get the maximum score in these kind of stations. So treatment refusal, as well as the stations where patient is saying, I want to go home. So self-discharge cases as well, right? Number one, in ethical scenario, no matter which topic you are doing, please always take care of these 4 points. These are the most important one. First is voice control. I always mean this is soft spoken. You have to be soft spoken in the exam, right? So you need to work on it. Make sure you are soft spoken. Make sure you give proper eye contact. Many times you will see that your patient is not giving you eye contact. That's okay. But what you need to do, you need to give eye contact to the patient. You have to keep looking at the patient because you will see your patient will be giving you lots of non-verbal cues as well, right? So non-verbal cues. So we can't afford to miss these non-verbal cues. Anytime if you see something unusual, whatever you see, you say it as well. So this is really important. I mean, whenever you get any non-verbal cue, you will say it as well. So proper eye contact, keep looking at the patient overall, how the patient is doing. If the patient is shaking his or her leg, patient is looking here and there, patient is coughing. I mean, anything unusual you will see, you will acknowledge it. Okay. Then noting, yes, many a times, specifically in treatment refusal scenarios, you will see the patient is talking a lot. Patient is talking, and talking. So maybe out of 8 minutes, you will see they're talking for 4-5 minutes. So how are we going to get marks? Can we interrupt them? The answer is no. So how are you going to get marks? You will get marks for good listening as well. We have to have good ears. We have to have good listening skills as well. So if they're talking, let them talk, but give them active signs of listening. What would be active signs of listening? I'll just nod my head. Okay, yes. All right. So that is something that you can do as a part of listening. All right. The next point I mentioned is the keep distance. So it depends on station to station because like you're sitting a bit you're sitting at a distance from the patient, right? So now you need to see what kind of scenario you have got. Sometimes you will see the patient might be a bit aggressive as well, and what they do when they're aggressive, they might come a bit close to you. When they come a bit close to you, what do? You go a bit back on your seat, meaning you still have to maintain the same distance. Many times you will see a patient, they will say, I mean, it's abuse cases, domestic violence cases. What's going to happen is they're not talking much. They're not talking much. So what you need to do, you might have to go a bit close to the patient just to build a rapport, just to make them comfortable. So these are the 4 points, and you will see in most of my slides, I use these 4 points, right? So treatment refusal or self-discharge cases, how we are supposed to manage. You've got so many scenarios on this topic, right? First of all is acknowledgement. I can't stress it enough how much this acknowledgement part is important in this exam. And to be honest, when you start working, acknowledgement will be a part of your life. You have to acknowledge everything. So, for example, you started the station, how can I help you? And your patient is saying, I don't want this treatment. So how you will acknowledge it? It's very easy. I can see you don't want this treatment. I can see you're not happy with this treatment. Is it difficult? It's not. So whatever patient says, you reflect it back. You just say it, and this is what you mean by acknowledgement, right? I don't want this treatment. I can see you don't want this treatment. I want to go home. I can see you want to go home, right? So do this thing. I know a lot of us, we think why we're saying this line, it is of no use. I mean, what are we getting out of it? No, acknowledgement you have to do. It will make you a good listener as well. Like whatever patient has said, you reflected back, it means you are a good listener. And patient is like, yeah, the doctor is listening to me, and patient will be more comfortable in giving me the history. And I would say you will have much better rapport with your patient as well. See, patient is refusing the treatment. Yes, it is the patient's right. If they want, they can definitely refuse the treatment. It is the patient's autonomy. We have to respect the decision of the patient regarding their treatment. But as a doctor, I need to tell the patient as well what worse can happen. And I'll try to find out what's the reason why it's refusing the treatment. I'll try to solve those reasons as well. And that's what you need to do in these kinds of scenarios, right? So first thing is acknowledgement. Yeah. Now, in these kind of stations, specifically, I would say in all the ethical stations, do not come to the conclusion straight away. What I mean by that, okay, patient is saying, I don't want to take this treatment. And I've seen a lot of candidates, they go straight away. Why? Why you don't want to take the treatment? That's not wrong, but what I would advise is first get a bit of understanding about the scenario, what exactly the scenario is, why the patient is in the hospital, which treatment you are giving, all those things, isn't it? We have got 8 minutes. You always divide the station into two parts. One is gathering the data, that you gather something. And in the second half of the station, what you do, you give the information to your patient. So that is what we do, right? It's pretty clear. So before you go into why, ask a bit of thing. That is what I mean by my second point, patient safety, meaning assess the patient's condition, assess the patient's current situation, meaning ask the patient why actually you came to the hospital, what was the reason behind it. Maybe patient is having some symptoms. Maybe patient had fever, patient has cough, patient has shortness of breath. Now you can ask, how are you feeling now? How's your cough now? How's your fever now? How's your shortness of breath now? So you can ask all those questions. Now, tell me one thing, why are you giving the treatment to the patient now as well? Because patient is still having some symptoms, right? So if you take a bit of history now, patient might say, I still have fever, I still have a bit of cough. So what's going to happen? These symptoms, which patient is having now, you can use those symptoms in the later part of the station to convince the patient to stay in the hospital. Meaning you can say to the patient that you still have cough, you still have fever, you still have shortness of breath. So it's advisable you take this treatment. So that is something that you can do in the later part of the station. So what is more important? Taking a bit of history, getting the understanding why this patient is in the hospital, which treatment he's getting, right? So that is something that you need to do, right? So acknowledgement of the emotion, that's the most important thing. Then you ask some questions, taking a bit of history. Now, I've seen sometimes what happened is a lot of candidates, they go into too much of detailed history. Like they go into detailed past medical and lifestyle history as well. Then it may not be a good idea as well. Because see, we need to understand the aim of the station. The aim of the station is patient is refusing the treatment. We need to talk to this patient. So you need to have a good chat about that treatment refusal part. So if you go into too much of history or spending 5 minutes in the history, that's not going to make sense as well, right? So optimum history, meaning assessing the current situation of the patient, that kind of history you are supposed to take here, right? So why you are admitted and which symptoms you have now. How are your symptoms now? So these are the questions that you can ask. Okay. Fine. Now, obviously, patient is saying, I don't want to take this treatment or I want to go home. So obviously there is a reason, isn't it? There is a reason. And what you need to do, you need to try your best to find out that reason, right? So the reason, for example, the reason is, doctor, the treatment that you're giving me has got side effects. Okay. For example, you are given some inhalers to the patient and patient is like, no, I don't want to take your inhalers. So you're like, towards the reason behind it. Patient is like, it has got side effects. So we know, we as a doctor, we know every medication has got the side effects, right? But what we can do, we can manage the side effects. That's the thing. So there is a problem, you find out the reason, and what you do, you try your best to resolve that problem, right? Doctor, it has got side effects. And what you say, yes, every drug has got side effects. Every medication has side effects. But what we have got, we can manage those side effects, right? You can also say the benefits are more than the side effects. See, every medicine have got the side effect, but the benefits are more than the side effects. So it's advisable you take this medication. Right. Now you have to be very clear the language that you are using. You cannot use the forceful language. You have to use convincing language. Because at the end of the day, it's the patient's decision whether they want the treatment or no. And you as a doctor has to respect that decision, right? So you cannot use the word, you should take this medicine, you must take this medication. No, it is advisable to continue this medication. It's advisable, it is recommended that you take this medication. So try talking in this way. Don't force the patient. You only try to convince the patient. Okay. Now, another reason, so there can be so many reasons. The scenarios that we have got, patient will have different reasons. This is just an example I've given it to you. The reason for not taking the treatment could be side effect. I'll give you lots of other reasons as well. For example, there's a reason that they're giving morphine to the patient. The patient is saying, it is addictive, I know, and I don't want to take it. Now the question is morphine addictive? The answer is yes, it is, if it is taken for the leisure purpose, if it is taken for the recreational purpose. But as a doctor, why are you giving morphine to the patient? Maybe for the pain, yeah? Are you going to give it for a very long time? Not really. So if you're taking it for your pain for a short duration, you will not become addicted to it. That's the main thing, right? So this is how you need to see. So every patient will have their own reasons for not taking the medicine. So you need to try finding that reason, and what you do, you try to solve that reason. All right. Sometimes what happens is there is a case patient is saying, I don't want to take these medication. Why you don't want to take this medication? Because the medications are not helping. If I'm taking it, I'm still having the problem. I'm still struggling to breathe. I still have shortness of breath. If I walk few steps, I really feel short of breath. Then what is the point of taking the medicine? So the reason is the medicines are not working. That is the reason that your patient has given it to you. So what is the solution? First of all, if patient is taking some medication and saying the medications are not working, the first thing that I'm going to do is I'll check the compliance. If the patient is taking these medications properly or not, or if they are missing any dosage or so. If you are missing the dosage, obviously the medication is not going to work the way it should be. If the patient is having proper compliance, patient is taking as prescribed, patient is not missing any dose, but still having some problem. So what we can do? Can we review the medicine? Of course, we can review the medicine. So we can refer you to the specialist and maybe we can review the medicine. Maybe we can increase the dose of certain medication. Maybe we can add some medication. That is something that we can do. So what you did, you find out a reason and you try to solve that reason, right? There's another case patient is saying, why I don't want to take the medicine is like, I'm 75. I have lived enough. I don't have regrets in my life. My wife has passed away. My friends, they have passed away as well. And I think I have lived enough. And if I die, I mean, it's fine. So the thing is, this patient is feeling lonely. This patient is feeling lonely. He always says that I'm just sitting at home doing nothing. I can't go out for a cup of coffee. Then what's the point of living this kind of life? I mean, it's understandable. The patient is going through a tough time. So what you need to do in these kind of scenario, when patient is saying, I'm living alone. So you can encourage them to take part in some activities, because what we have got the community clubs and all. We have got the community clubs. Every local community, they have got the clubs and also patient can go there and they'll be able to talk to each other. And what's going to happen? That's going to be quite helpful. Now, what is going to happen? They're talking to few people. They will feel much better. There's another service that we have got is Age UK. Age UK. So what happens in that? So simply a person, it's a voluntary service. Even if you want, you can be a part of it. So somebody is going to come to your house maybe once a week and they'll have a cup of coffee with you. They'll have some chat with you. And what happens? You just feel better, isn't it? The same thing can be done over the phone as well. If the person is not having enough time to come to your place, so what they can do is they can do it over the phone as well. So what we call it as telephonic befriending. So they can call you at that time and they'll have a chat with you. So you will feel much better. Sometimes the problem of the patient, the reason is, doctor, I'm just staying at home. I can't go out. And the whole day I'm staying at home, I don't consider that is life. Okay. So if the problem is the mobility, so what we can offer to this patient, maybe we can offer some mobility scooters as well. You will see in the UK, a lot of patients, they are going on the mobility scooters. So they are not able to commute, they're not able to walk and all. So what can happen is we can go with this the scooters and all. So the patient will feel much better when they are able to go out of their house and they're able to go here and there. So they will feel much better, isn't it? So the moral of the story is you need to find out a reason. You've got so many scenarios, and every patient will have a different reason for treatment refusal or for not staying in the hospital, isn't it? So you need to find out the reason and try solving it as well. That is the main thing, right? Okay. Another reason, for example, there's a case patient is saying, I don't want to stay in the hospital. I don't want to stay in the hospital. Okay. So why you don't want to stay in the hospital? Patient is like, I love smoking and the staff is not letting me smoke. Now the answer is, first question is, if I'm admitted in the hospital, can I smoke? Obviously not in the hospital, but can I go out, smoke and come back? Is it okay in the NHS hospitals or not? The answer is yes, it's absolutely okay. I mean, obviously, as a doctor, I'll try my best to convince the patient and I'll try my best to tell the patient the ill effects of smoking, that smoking is not good for health and everything, right? But at the end of the day, patients, even if they're admitted, they can go out and smoke. It's absolutely okay. And the patient is being very rude sometimes, saying, can you stop me from smoking? I love smoking. So when I go out and smoke, what's the big deal? So the thing is, yes, you can tell the patient, see, if you want to smoke, nobody can stop you. But smoking is not good for your health. Smoking is going to delay your healing. I know you want to go home. We want to send you home once you're fine. But if you continue smoking, it's still going to take longer, right? So it's advisable you cut down and eventually stop smoking. I know it's not easy, but you are not alone. We have got so many options for you. Would you like to hear some? So what we did, we tried finding it out reason and trying to solve it. But be very careful. You are not going to force any patient for it. So your language has to be convincing. You're giving the options to the patient, and patient is going to choose whether they want to quit smoking, whether they don't want to quit smoking. It's them. They will decide. We are nobody to discuss this thing. We are not nobody to tell these things to the patient. Okay, so I think I've given you enough examples, and as we go along, I'll give you some more. So first thing, if the patient is refusing the treatment, is you acknowledge, you acknowledge, you acknowledge. That is the main thing. Patient safety, what I mean by that, do not jump to the topic straight away. What I want you to do is take a bit of history, take a bit of history, try finding it out, why they're in the hospital and which symptoms they had, which symptoms they have. So still they have some symptoms, maybe you will be able to use those symptoms to convince this patient to stay in the hospital. So, and it is going to be very helpful in building the rapport as well. Many a times you will see a lot of information is given to you in the question itself. Can I use the information from the question? Of course, yes, use that information as well. That's going to be very useful, and it's going to be saving some of your time as well, right? So acknowledgement of their emotions, patient safety, taking a bit of history. Then I will try my best to find out the reason why this patient doesn't want to take the treatment. Find out the reason, and then you solve that problem. You try to solve that problem, right? So find out the reason and solve the problem. The problem could be side effects. The problem could be anything. The problem could be I'm living alone. There is nobody there. So maybe you can ask some questions about depression as well. Or what you do, you can offer Age UK, or you can offer maybe something called like you can join the community clubs and all. They will be able to talk to other people, and that's going to be quite helpful for you as well. So that's what you do. So find out the reason. You try to solve that problem as much as you can. Your job is to offer the solutions, and your patient might refuse those solutions. That is absolutely fine. They have got the right to refuse the treatment as well. Okay. And then obviously you can tell them like the benefits are more than the side effects. So after doing this, now your patient is still saying, I don't want to take this treatment. I mean, you tried finding it out the reason, you try to solve those reasons as well. You give lots of options to the patient, but patient is still having the same mindset. Doctor, I have made my mind. I don't want to take this treatment. So now we know patient has got the right to refuse the treatment as well. But you need to check one thing, whether they are competent enough to make their decision, whether the patient is competent enough to make their decision or not. Because if they're not competent enough, then you cannot just go with them. There are lots of instances when patient is not competent. You can even keep them in the hospital against their wish as well under Mental Health Act, right? And what you need is mostly you need a psychiatrist colleague to do those sectioning and everything, right? But here, in a very simple language, how can I check the competency level of this patient, whether this patient knows the implications or consequences of their decision or not? So you need to check if they have got the understanding, if they can return that information, and if they know the most important point, if they know the consequences or if they know the implications of their decisions or not. So for example, we were giving, say, heart medications to our patient. We were giving aspirin, clopidogrel, ramipril, bisoprolol, statins, diuretics. So patient was getting these medications, and patient is saying, I do not want to take these medications anymore. Okay, that's fine. I mean, and we tried finding it out. The reason could be the medicines are not working. Then you gave your explanation as well that check the compliance first and offer the patient, we can review the medicines as well. You offered everything, but patient is still having the same mindset saying, I do not want to take this medicines. Obviously, it's the patient's right, but then I'll check this competency level. So how to check? Do you understand? Can you repeat? Do you know the implication? What I mean by this line? So now, patient said, I do not want to take this treatment. So he'll ask simple question. Do you know, if you will not take these medicines, meaning aspirin, clopidogrel, ramipril, bisoprolol, statins, diuretics, do you know if you will not take these medications, what's going to happen to you? So that is what I'm trying to check is the implication, the consequences. Do you know the consequences? Do you know the implications of not taking the medications? The patient might say, yeah, okay, my condition will get worse, but I have made my mind, I do not want to take this medicines. Do you understand? Yes, doctor, I understand and I've decided I do not want to take this treatment. Right? So that is your retention of information as well. So this is what you need to check. The most important question I would say when you're checking the competency level of the patient is, do you know the implications? So do you know what's going to happen to you if you will not take these medications? Doctor, I know my condition is going to get worse. So do you understand that? Yes, doctor, I understand. And I made my mind, I do not want to take this treatment. Okay. So this is something that you can do. Right. Now, as a doctor, as a doctor, it's your duty to tell them what worse can happen. Obviously, again, I'll repeat the same thing. Patient has got the right to refuse their treatment as well. But as a doctor, it's your duty to tell them what worse can happen if they will not take this medicine. For example, the patient said, when you ask the question, do you know the implication if you'll not take this medication? Yes, doctor, I know my condition is gonna get worse. I'll die or die peacefully. You understand? Yes, doctor, I understand. I've decided I do not want to take this medicine. Now, as a doctor, I'll tell them, okay, so, John, if you will not take these medications, you're taking aspirin, you're taking clopidogrel, you're taking ramipril, statins. If you will not take these medicines, you understand that your condition will get worse. You said you'll die peacefully, but I would like to raise one point that if you will stop taking these medications, first of all, these medications are not going to completely treat your symptoms. These are going to be there to manage your symptoms. And if you will not take this medication, the condition can get really bad. For example, if you stop aspirin, what's going to happen? You will be prone to have maybe another heart attack. You'll be prone to have stroke as well, which is going to be really difficult, isn't it? So it's not gonna be peaceful. It's gonna be really, really troublesome in the future. So it's advisable you take this medicine. But at the end of the day, it is the patient's decision, right? Now, in the end, I would advise you to try involving the family friends as well. Obviously, when you're taking the history and all, take psychosocial history. That is very important. Psychosocial history will play a very important part here because see, somebody is taking the medicine for a very long time, isn't it? They get a bit like fed up of taking the medicines as well, and you can ask how's the mood of the patient and all. That's quite helpful, right? Now, you have taken the history. Now ask the patient, see, it is your decision. We respect your decision, but would you like to speak to someone? Would you like to speak to someone from your friends and family before you take this big decision? We respect your decision, but it is advisable you discuss it with somebody. Would you like to do that? No, doctor, I have made up my mind. Okay, then you can tell them, see, it's advisable, but it is entirely up to you. We respect your decision. What I'm going to do, I'm going to speak to my seniors as well, and we will do what is needful. Right? So that's what you can say. Because see, who we are, in all the stations, we are an FY2. So do you think the final decision should be done by FY2? You can, but I would always advise to have the seniors in the picture in the end. And that's what I want you to do. Involve the seniors and finish the station, right? Again, a lot of doctors I know, they think that if I'm not able to convince the patient, I'm going to fail the station in the exam. This is not like that. the patient has got the right to refuse the treatment as well, that you know, right? And you will not lose marks if you're not able to convince the patient to stay in the hospital or to get this treatment. Because maybe the examiner has trained the patient in the morning itself, saying, no matter what this doctor is going to do, you don't have to get convinced. So that can happen. That can happen, right? So any kind of scenario you might get in the exam. So it is their right to refuse the treatment, right? Let me summarize it in 2 minutes, what we have done till now. So first thing, when patient is saying, I do not want to take the treatment, acknowledge. I can see you don't want to take the treatment. I can see you are not happy with the treatment. I want to go home. I can see you want to go home. Guys, acknowledgement is pretty easy. Please do it. Now, before jumping into the scenario, what you do, you take a bit of history. Try getting a bit of idea what the situation is. So take a bit of history, do the assessment of the patient's current condition. Do the assessment of the patient's current condition. Why the patient came to the hospital, which symptom patient had, which symptoms patient is having at the moment. Because these symptoms I'm going to be using in the later part of the station to convince them to stay in the hospital. Right? So that is what I mean by the word patient safety, taking a bit of history. Third point, find out the reason. They're refusing the treatment, they're going home. Find out the reason. Why? Why? Question them why. So whatever the reason they will give, try to solve that reason. For example, take one reason. The reason is the medicines are not working. So what we can do to resolve it? We can review the medicine. First check the compliance and then we can review the medicine and we can change the medicine. We can put you in contact with the specialist. Sometimes the reason is the medicine that you're giving has got so many side effects. Yes, every drug has side effects. What we can do, we can manage these side effects. And the benefits are more than side effects. That's why we are giving this medicine. So that's your explanation to that point. Okay. Now, what you need to do, once you have answered all their whys, why you don't want to take the treatment, and you have answered all those why, this patient is still saying, I don't want to take the treatment. Yes, they have the right to refuse the treatment, but what I'm going to check, I'm going to check their competency level. How? I need to check if they have got the understanding, they have got retention of information, and if they know the consequences of not taking the treatment. So do you know what's going to happen if you will not take these medications? Doctor, I know my condition will get worse and I'll die, I want to die peacefully. Do you understand? Yes, doctor, I understand. And I've decided you don't want to take this treatment. Okay, so you can tell the patient, like, if you stop this treatment, like the heart medication that you're taking, it's going to make things worse. It's not going to be peaceful. It's going to make things worse. For example, you're taking aspirin. What's going to happen if you stop it? You will be prone to have a heart attack, be prone to have a stroke as well. So it's advisable you continue taking these medications. Again, make sure you're never using the word that is forceful. You must be avoided. Okay. Always advisable to go for social history as well, somewhere in the station, and bring it up. Would you like to speak to someone? Would you like to speak to your wife? Would you like to speak to your son, your daughter? You're making a big decision, and it's always advisable if you involve them in the decision making as well. Doctor, no, I have made my mind. That's it. All right, we respect your decision, and you can always make your decision. And if you want to reverse your decision, you can do that as well. Moreover, what I'm going to do, I'll speak to my seniors as well. They might be coming to you and having a chat with you. But I just want to say, we are always here to help you out. Okay, so that's what you need to do in the station where we are dealing with treatment refusal or self-discharge. All right. Right, so let's read.